Bismillahirrahmanirrahim. I'm Dr. Rashida. Good morning, everybody. Hope the best for everyone. Today, our 5-minute topic of discussion is premature ovarian failure. This premature ovarian failures, if you will see it in this figure, in the normal ovaries, there will be a functioning ovary with the ova producing ova. But if there will be a premature ovarian failure, non-functioning ovary with no ovum is producing. This is the basic of that one. Then, if we will go for premature ovarian failure, we have to understand that the premature ovarian failure means what? Premature ovarian failure is before the age of 40. There will be a menopause. There is an early onset of typical symptoms of the menopause, and in the ovaries occurring in the normal activity, there will be a decline in the ovarian activity. Then, if we will go for the premature ovarian insufficiency, if we'll go, what is this early menopause will make it? What is happening from the hypothalamus? The hormone will come to the pituitary, and the pituitary it will affect on the gonads. So what will happen? There will be a lack of negative feedback that the hormones which are coming from the hypothalamus to pituitary to the gonads. So they will, if there is a hyper secretion, they will send the feedback mechanism, and then there will be a secretion will be less. But there in premature ovarian insufficiency, there will be a lack of negative feedback. There will be a hypergonadotrophic hypogonadism. There will be excessive means hypergonadotrophic means excessive gonads will be there, but on the gonads it is not affecting, means there will be a underactivity on the gonads. And there will be a gonadotrophin will be increased, LH and FSH will be increases. Then if we will go, what will be the causes? The causes will be idiopathic, more than 50% are the idiopathic. Then iatrogenic causes, that means medical intervention like the chemotherapy, radiotherapy, surgery, or the oophorectomy. Then autoimmunity will be another cause. Genetic will be cause. Genetic means will be the familial history, and then there will be a Turner syndrome. Infection will be the mumps, tuberculosis, and cytomegalovirus virus. And if we will go for the presentation, how they are going to present these women, how they are presenting. The symptoms of low estrogen means what? It will be hot flashes, night sweats, vaginal dryness, and the irregular menses with the periods will be irregular. And there will be a secondary amenorrhea after before with after 6 months. Okay, then there will be how we will diagnosis that with the from the woman's symptoms and the some investigations. There will be these women are younger than 40 years of age, and there will be a typical menopausal symptoms. And if we'll go for the blood test, there will be elevated FSH level. It will be more than 25 international unit. In two consecutive samples we need, which has to be more than 4 weeks apart. Then we will go what premature insufficiency is going to be associated. This higher, there will be a higher risk of, as there is a higher risk of lack of estrogen, there will be a Parkinsonism, there is a cognitive impairment like dementia, osteoporosis, stroke, and cardiovascular diseases. What will be the menopausal symptoms? You can have a psychoaffective changes like mood, liability, insomnia, irritable, vasomotor symptom, hot flashes, night sweats. And urogynecological sexual changes will be amenorrhea, vulvovaginal atrophy, low libido, dyspareunia. And what are the long-term sequels? Will be the accelerated cognitive impairment, accelerated cardiovascular disease, autoimmune disease like adrenal and thyroid, infertility, and osteoporosis and premature mortality. What will be the management? Management will be there mostly because they become menopause before the age of 50, so they need the hormone replacement therapy. The hormonal replacement therapy will be taken at the age until typical menopause will occur. Up to 50-51 they can have it. It will relieves her risk of cardiovascular problem, osteoporosis, cognitive problems, and psychosexual problems. But there will be still there will be a small risk of pregnancy. This will require contraception because it will go as there will be a spontaneous ova will be released, and if she has sexual activity, then she can be pregnant. If she don't want to be pregnant, then she has to have a contraception or hormone replacement along with the contraception for the prevention of the pregnancy. The management of this will make it if there is a if she don't like to have a hormonal replacement therapy, then she can use the combined oral contraceptive pills. The mostly they will usually accept this contraceptive pills because there is a negative news about the hormonal replacement therapy in the news. And then the last will be the management will be there with the general population. Mostly they will accept for the hormone this contraception. And what are the risks of this hormone replacement therapy? This will be the most important, and there will be increased risk, but the most important risk is the thromboembolism. But the risk, we can reduce this risk with the use of the transdermal patches instead of the oral hormone replacement therapy. Thank you so much.